Welcome, and thank you for taking a few minutes to learn about how your body truly works. I'm Dr. Sandy, chiropractor at Ager Chiropractic Wellness Center. Today we're going to talk about how your body heals, how your spine and nervous system control that healing, and how spinal rejuvenation therapy, or SRT, helps you stay healthy for the long run. Let me start with a simple question to think about. Is it really possible to live a life with less pain, less sickness, and less physical decline? I believe the answer is yes, and the key lies in how your nervous system is functioning. We're here to give you the tools to stay feeling young and healthy for the rest of your life. But first, let's talk about the state of healthcare. The World Health Organization studied the top 100 healthcare systems in the world. Do you know what they discovered? The United States is #1 in the world in emergency medicine. If you're in a car accident or having a heart attack, you're in the best place in the world to survive it. But when it comes to overall health and longevity, the US ranks 37th. That means that many countries with fewer doctors, less technology, and fewer medications are actually healthier than we are. So something in our approach to health is clearly missing. Let's take a moment to talk about the 3 leading causes of death and what they share. Third is cancer. About 500,000 Americans die from cancer every year. We often assume it's genetic, but over the past 40 years, there's been a 10-fold increase in cancer. Do you think that our genes have changed that much in 40 years? Newsflash, our genes haven't changed in hundreds of years. So what has changed? You guessed it, our lifestyle has changed. Research shows that 95 to 98% of cancer is related to lifestyle and environment, not heredity. Billions of dollars are spent on cancer research and treatment annually, and the rates continue to go up. Something isn't working. The second leading cause of death in this country is heart disease, which takes roughly 800,000 lives annually. It's often called the silent killer because 60% of the time, the first symptom of heart disease is a fatal heart attack. Just because that person wasn't feeling symptoms the day before, did that mean they were healthy? Obviously not. We're told that a lack of symptoms means we're healthy. I mean, if it ain't broke, don't fix it, right? The #1 leading cause of death in the United States may surprise you, but I have the research to back it up. The leading cause of death in the US is medical care itself. According to the Journal of the American Medical Association, 212,000 people die annually from adverse drug reactions. And even more shocking, we also know that only 5 to 20% of those events are actually reported. So that number is much higher. You can't watch TV for more than a few minutes without seeing a drug ad. My favorites are the ones that are for side effects of other drugs, like the one to help with opioid-induced constipation. 145,000 people die annually from unnecessary surgeries. There is no safe surgery. When possible, always exhaust all other options before surgery. I can't tell you how many people I've met that wish they'd met a chiropractor before they let a surgeon cut into their spine. And lastly, 100,000 people die from infections they contract in a hospital every year. This isn't to condemn medicine. Emergency care saves lives, but it shows that more drugs and more procedures don't automatically equal better health. The encouraging part? All of these leading causes of death are largely preventable. Your body is designed to heal. Your body is built to heal itself. If you get a cut, you don't have to tell your body what to do. It just heals. That same healing intelligence is inside you right now. We all started as 2 cells that in 9 miraculous months became a human body with bones that support us, muscles that move us, a heart that beats, lungs that breathe, a liver that livers, kidneys that kidney, and a brain that with all the research and money we can throw at it, we only know a fraction of what it's capable of. If you haven't stopped to think about and appreciate and honor how amazing the human body is, it's time to start. Now, let's get back to the cut. That healing power travels through your nervous system, your body's master control system, which runs from your brain down your spinal cord, out through your nerves to every cell and organ in your body. If that nerve flow is clear, your body is able to function optimally. If it's interfered with, your body struggles. The truth is, your body, your cells, your organs, your muscles, all of it is made of energy. Depending on when you're listening to this, it may not feel that way, but you are a bundle of energy, and that energy is what's keeping you alive and well. That energy is flowing literally in your body as electricity. Your heart could stop. You could stop breathing, but you'd still be alive. You aren't officially dead until there's no electricity between your ears. Your central nervous system, or your brain and spinal cord, is so important that it is the only one of your 9 systems that's surrounded by bone for protection. Your skull and your spine. A healthy spine is straight from the front and has gentle curves from the side. Think of a garden hose. When it's straight, water flows easily. Put a kink in it and the flow is reduced. Your spine works the same way. When stress shifts your body out of alignment, we call it a subluxation. Subluxations create tension on your nerves. You may not feel pain, but your body still feels the impact. It only takes a small amount of pressure on a nerve to compromise its function. Common signs of nerve stress include fatigue, headaches, poor posture, digestive issues, recurring aches and pains. Fatigue is the number one symptom. So let's do a little exercise. Wherever you are right now, I want you to hunch over. Think bad posture, shoulders and core slumped, head forward, looking down. You know, the posture a lot of us spend much of our day in. Now try to take a deep breath. Okay, now sit up nice and tall. Shoulders back, head up, core engaged. Now take a deep breath. What did you notice? Was it easier to breathe? Did that feel better? No wonder we're walking around feeling tired all day. Our crappy posture is causing a lack of oxygen to our tissues and our brain. There are three main types of stress that cause subluxations. Some of them we have control over, and some of them we don't. The founders of the chiropractic profession cleverly called them the 3 T's: traumas, toxins, and thoughts. So number 1, emotional stress, work, relationships, finances. Number 2, chemical stress like medications, processed foods, alcohol, pollution, household products, and body care products. And last, physical stress. Accidents, sports injuries, poor posture, poor sleep positions, repetitive motions in our day-to-day, and too much sitting. Did you know that sitting to the spine is like sugar to the teeth? It rots it out. Over time, the stress accumulates and shifts your spine out of alignment. Again, 95% of people wonder why, regardless of age or what they do every day, they're still so darn tired all the time. And this matters for kids, too. Spinal stress can begin at birth or even before birth, depending on their positioning inside mom. Babies are supposed to be born naturally, but now doctors feel like they need to intervene, often by putting excessive force on a baby's neck. I won't go into the graphic details. I'll just say that C-sections are no better. All babies, regardless of how they came into this world, should be checked for subluxation. Kids don't often complain of pain, but many experience recurring ear infections, asthma, allergies, or frequent colds. These are all signs of a nervous system that's not functioning properly. If they're not eating, sleeping, and pooping the way they're supposed to, a chiropractic evaluation is in order. Your neck curve, or the arc of life, protects your spinal cord. When that curve is lost, the cord becomes stressed and nerve flow decreases. Most low back problems actually begin in the neck. A scientist named Alfred Reed studied anything and everything related to the spinal cord. In one of the studies, he looked at patients with multiple sclerosis. You may have heard of it, but don't know what it is. You see, your nerves have a protective sheath around them called myelin. In MS, that myelin sheath breaks down, and now you basically have exposed nerves with no protection, like if you took the plastic coating off the electrical wires in your house. These people end up in walkers or wheelchairs and eventually die. Dr. Reed brought a group of MS patients of all ages, genders, and races. The one thing they did all have in common was a loss of the normal cervical curve. What they did was a brutal surgery where they sliced them open, peeled back the muscles, and pounded a curve back into their spine. Then they used wire mesh to artificially hold that curve in their neck. They sewed them back up, and guess what happened to their MS symptoms? They went away. But nothing was done to strengthen and rehabilitate the muscles that are responsible for maintaining that curve in their neck, and slowly over time, the curve went away and the MS symptoms returned. That's where we do things very differently. We're going to show you how to restore that curve naturally with no surgery required and keep it that way. Pretty exciting, right? Now, why did that work? If I put 2 MRIs side by side of a cervical spine, one with a normal curve and one with a reduced curve, you would see that the spinal cord in the curved cervical spine was much thicker than the one without. Thicker cord, more energy. Your MD may not catch this, but if you're in a car accident or suffer a sports injury and have neck pain, they'll tell you you're fine if you don't have anything broken or bleeding. If that's true, then why do you still have pain and headaches years later? Over time, the subluxations created by that trauma cause progressive degeneration. As your discs slowly break down, your posture gets worse and worse. Even if you've been seeing a chiropractor the whole time, that degeneration is still slowly progressing. All right, gut check time. What can you not do or enjoy now? Maybe you can still do your work and your hobbies, but do you still enjoy them as much as before or as much as you should? We all know if we're not at our best physically, we aren't as happy or as healthy or as kind or as loving as we want to be. Maybe even a little bit short or grumpy sometimes. Fast forward 20 years from now. How about 50 years from now? What do you want to be able to do? If the problems we have aren't taken care of now, as we get older, what's going to happen? And who do you want to do it with? Because we want to help you get healthy, but also get your loved ones healthy as well. All right. So rejuvenation is the opposite of degeneration. So let's do that. Spinal rejuvenation therapy is a state-of-the-art system that combines chiropractic adjustments, posture correction, spinal exercises, and neurological retraining. Only about 1% of the chiropractors in the world are doing this work, and now I'm so proud and honored to be one of them. We don't just adjust your spine, we help you rebuild its proper shape, strength, and stability. We're going to work on getting the weak postural muscles stronger so that you get lasting results. About 2/3 of your long-term care results come from what you do at home. We call it flossing your spine. First, we have to find out what you're able to do at home. After you've done our SRT warm-up exercises and had an adjustment, we'll take a weighted x-ray of your neck and lower back. Using a head harness, we place a small amount of weight on the front of your head and on your pelvis. Your body reflexively moves away from weight, so if I put a little weight on the forehead, you'll pull your head back. Same idea with your pelvis. If we see improvement in your posture on the stress films, we know you're strong enough to do this work at home. Next, we gotta make Jell-O. Wait, what? Yep, Jell-O. To make Jell-O, what do we add? Water. Your nervous system is 90% water and your discs are 88% water. They're considered white tissues, which means they don't have blood supply. This means the only way to get water and nutrition into your discs and waste out is to move them. But if you have abnormal motion in your spine, that motion is decreased and that disc dries out like a kitchen sponge. When we adjust your spine and get it moving again, we get those discs pumped up again. Also means you need to be diligent about drinking enough water every day. Half your weight in ounces is the goal. If you have joint damage, there are also supplements we can recommend that'll help your body rebuild. There's a series of exercises we'll teach you to do in the office to warm you up for your adjustment. These are also included in the exercises you'll do at home. We'll start with repetitive cervical traction. This exercise helps you stretch the tissues and influence that curve into the neck. Then we move on to the wobble chair. This specialized chair is designed to put the motion directly into the spine while you sit on it and use your abs to wobble in every direction, getting movement and hydration to those discs before your adjustment. Then we head to the vibration plate. There you'll do a 6-way neck stretch while standing on the vibration plate. The vibration causes muscles to contract and relax very quickly, which tires them out, allowing you to get into those tight spots better than stretching alone. Last, we do a little foam rolling of our thoracic spine to get the kinks out and get it ready for your adjustment. Then, many of you will move on to the decompression table. This specialized table helps to separate and open the joints, which creates a vacuum inside the discs to pull water and nutrients back in and maybe even pull the disc bulge or herniation back into a normal position. Then, you'll get your adjustment. After the adjustment, then we wear weights. This you'll have the equipment to do at home. 10 minutes on a vibration plate or walking on a treadmill with weights, or 20 minutes just wearing them around the house. The last thing you get to do is your exercises on the home fulcrums. This is where we mold the Jell-O. On these fulcrums, we do isometric exercises holding and strengthening postural muscles and spinal ligaments. As you get stronger, we gradually progress through more advanced exercises, and eventually the curves in your spine return. With consistent work, your body's amazing innate ability to heal reveals itself before our very eyes in the progress x-rays we take at specific intervals during the course of your care. There are 3 phases of care. We start with crisis care, reduce inflammation and pain, get you back to vitality and enjoying the things you love again. Once we're out of crisis mode, your body can function better and focus on healing. This is the corrective phase of care. We do progress scans at 30 and 90 days to make sure your nervous system function is improving. If you're doing your exercises, we'll see changes already in that first rescan at 30 days. Most chiropractors go years before they take new films, or may never do so. I admit, before I completed this training, I was one of them. But we're working with the most vital system in your body, and that requires precision, not guesswork. Lastly, we move into the stabilization phase of care. This includes adjustments once a week to once a month. And you continue to do your exercises consistently at home until we complete a full year of care. Remember, ligaments and discs are white tissue with no direct blood supply, which means they take longer to heal than muscles or even broken bones. In my opinion, stabilization is the most important phase of this plan. If we invest time, energy, and money into restoring our spinal health, doesn't it make sense to do the work to maintain it? Maybe you've spent time and money on braces only to have your teeth go right back to crooked because you didn't wear your retainer. Not doing the work to maintain your spinal correction would be just as silly. And I'm sorry to say, stress isn't likely going away anytime soon, so we have to be proactive in taking care of our health. One thing is for certain, you can invest in your health now, or illness is going to cost you dearly later. But the choice is yours. So let's wrap this up. Your body is designed to heal. When your nervous system is clear and your spine is aligned, your body can do what it was created to do. Our goal is to help you live healthier, longer, and with more energy. Feel free to share this with your family and friends. Most people don't know that care like this is even available. Thank you for listening. I look forward to seeing you soon.